you're looking to be maybe Kim Kardashian or maybe Ranbir Kapoor at 65 or 70 years old. She or he wants to freeze that age of 35 permanently, even if they are growing by time. Is it possible?
So self-care and self-love is one thing, and aging gracefully is another thing.
The social media is pushing us to get the best version of ourselves. So is that putting a lot of pressure on you guys? But the Instagram likes are the dopamine.
Yeah, but it's quite misleading. Aligning, making the shape different, tip smaller, tip bigger, or the sides of the nose smaller.
And it's a growing trend.
It is a growing trend.
What type of patients do you meet? Or what type of clients you can meet? I will not even call them patients, in fact.
Yes.
Because they are not patients, actually. They come with more enhancing requirements.
Right. I would say 60% are female, but
60%. 40% are male.
Are men.
Okay. Don't tell me that a male comes for jawline. I don't
so much.
Yeah?
You would be surprised.
Okay.
Yeah.
So if you remove this fat, will it come again?
Fat can come back if you don't fix your lifestyle.
This Anant Ambani, they can afford everything in this world. He's now vacuumed his entire fat out.
Yes.
He's still getting fat. What's the reply for that? In today's podcast, we will understand the two major types of plastic surgery. Reconstructive body, that includes scars, finger alignment, loss of hands or legs, facial birth defects, etc. And the second part is the cosmetic surgery. Botox, fillers, jaw slimming, eyebrow lifting, face lifting, rhinoplasty, liposuction, fat freezing, and so many other beauty surgeries. Yes, you heard it right. Plastic surgery. We believe we know a lot about it, but yet there's so much to discover in the unknown, especially when it comes to the procedures involved, how safe it is, the risk involved in doing these surgeries, the outcomes and the maintenance to take care of it, the cost involved. Lastly, what are the side effects if there's any? To clear all these doubts today, we have a distinct guest who will help us to understand all these aspects in detail. Yes, Dr. Faisal Ameer, gold medalist at LLRM Medical College, India, and Master of Plastic Surgery. In 2015, he was awarded the International Scholar Fellowship Program of Plastic Surgery by American Society and World Craniofacial Foundation. To his credit, he is a member of so many, almost 25 plastic surgeon foundations and societies that promote education and improvement of plastic surgery all around the world. So let us welcome Dr. Faisal Ameer to our show. It's an honor to welcome you on board.
Thank you very much. Thank you for having me.
When and how Dr. Faisal landed to Dubai?
Long story short, I received my basic training in India. Then I did my fellowships in US, did some training at different places. And after that, I decided to pursue my career as a reconstructive as well as cosmetic surgeon. And looking at my practice in India, it was mostly reconstructive. It was almost around 90% was reconstructive. Although now in metropolitan cities, cosmetic surgery is on the rise, but it's still very less as compared to what is happening in Dubai or in the Western world. And Dubai as such culturally was very, welcoming to me. I felt very,
welcome
so
here.
Yes, at home here. So I decided to do it here.
Just out of curiosity, why the word plastic surgery when you're conducting a surgery on a human body? I mean, how the word originated? I mean, I just out of curiosity, I just want to know.
So if you look at other specialties like neurosurgery, you immediately understand it's related to nerves.
What is the function of it?
Yes,
literally.
Urosurgery related to urogenital system, urinary system, gastrosurgery, stomach. But plastic surgery as such is not one system. And the name is derived from a Greek term called plastikos.
Oh.
which means molding. So the plastic which we know of comes from the same word, because it can be molded into different things, and we know it as mugs and buckets and everything.
Correct.
So plasticos comes from the word molding, and that's how, because our main work is tissue molding, whether it be a child getting plastic surgery for their congenital anomaly, or is it an adult for body contouring or reconstructive surgery. It's molding. Yeah.
We feel that the word plastic surgery, often we feel that we know a lot about it.
Yes.
And maybe it's almost because it keeps bouncing on our ears one on the other day. But when I deep down into my mind and I try to dig, okay, what's the real meaning of it? I'm not able to get the real meaning of the word plastic surgery. Or maybe I don't have enough information. Because most of my information is collected maybe from some movies, which I have seen in the past, which maybe someone would be attacked with acid, or maybe someone would have been hurt or would have been injured, and then the correction of the face or some body part is considered as plastic surgery. Does it have a deeper meaning to it? Or because when I now read today, I figured out there are two different major parts, literally when it came to constructive body, and then reconstructing the body, and the second part is about the cosmetic surgeries.
Yes. So definitely way beyond what we see on social media or what is shown in movies. Plastic surgery as a specialty really grew at the time of the World War, especially World War II. And there were hordes of soldiers who got injuries during wartime, and they were just dumped into the hospital. So the primary job of the surgeon in these hospitals would be to reconstruct and rehabilitate these people. And there were facial injuries
because of loss of legs, loss of hands, or because of fingers, limbs, loss of their body parts. So your job was to reconstruct.
Absolutely. And gradually the science of plastic surgery started. Although if you see historically, the oldest plastic surgery documented is nowhere else but India. It was Sushruta in almost 600 BC, who came up with so many procedures, and it's in his book known as Sushruta Samhita. And there have been procedures described for ear reconstruction, nose reconstruction, which is one of the most famous plastic surgery procedure described by Indians, and it's still called the Indian procedure for nose reconstruction. So gradually it started becoming popular in Russia, in America, in Europe, and everywhere people started reconstructing body parts.
Let's go to the next subject, the very most interesting, the cosmetic part, the aesthetic part.
Yes.
What are these words? Botox, fillers, then we have jaw slimming, then facelifting. Are these surgical procedures, or are they non-surgical as well?
Mostly
or they're just injectable?
There is a whole category of, let's say, injectable cosmetic procedures. Then there are non-surgical procedures. Then there are minimally invasive procedures. And then there are frank, surgical options. So injectable treatments as such are something which are so wide that there are doctors who just practice injectables and they don't do anything else. So there is so much of injectable technology and compounds and chemicals which can be used. As you said, Botox and fillers, these are one of the most common injectables.
Commonly used, especially the fillers in terms of lip filling and all.
Yes. There's a whole range, the whole spectrum of treatments. Botox is, to start with, Botox is a neurotoxin. It's a very potent poison, I would say. But then in a dose which is used for aesthetic purposes, it's not poisonous. It's used in a very minuscule amount, and it's used to weaken or soften the contraction of a muscle. Now,
so it's used to tighten the muscle or something like
to
that?
loosen the muscle, to relax a muscle. So, you can imagine that if I, raise my eyebrows, the muscle on my forehead is creating lines.
Correct.
And if I inject a little bit of Botox on my forehead, these lines are just going to disappear or become softer. And similarly, there are lines, everywhere in the face.
It's like reshaping that part of the body.
So relaxing muscle, which is creating the wrinkles on the skin. So that's the principle of Botox.
And fillers?
Fillers are nowadays there are compounds like hyaluronic acid gels, which are safe, which are similar to compounds which occur in our body, and we inject these gels in different parts of the body to create enhancement in tissue. I'm a very conservative surgeon.
What's the life of these fillers?
So hyaluronic acid, I would say, for lips will last for 5 to 6 months.
That's it?
Yes. No, initially people were injecting silicone oils.
Every 5 months they will have to go and refill their lips.
Do a top up. Yeah.
Okay.
So to start with, people started with paraffin oil. They started with silicone gels, but then it was permanent, but it created a havoc in the tissues. Even though it was permanent, it would cause so many adverse effects. So hyaluronic acid, even though it sounds that very temporary.
So where do you draw the line? Fine, this is where if you keep putting the silicone, it will affect your aesthetics to a large extent. Where do you draw that line, saying that I'm a doctor?
Yeah.
You're coming with something which is very irrational.
Yes.
As a patient, you're looking to be maybe Kim Kardashian or maybe Ranbir Kapoor.
Yeah.
At 65 or 70 years old. And it's not possible.
Yeah.
And where do you draw that line and you say this is not possible or this is going to risk the entire aesthetics of your body?
Correct.
Because from the soul he is very young.
Yeah.
But body is sagging.
Agreed.
So how do you manage that?
Yeah.
Because she or he wants to freeze that age of 35 permanently.
Yes.
Even if they are growing
Yes.
by time. They don't want to go older than that, correct?
Nobody likes to be older.
Nobody likes to be older. Yeah. So they said, okay, let me be 35 when at 65.
Yes.
So, and is it possible? Now, aesthetically, you have completely reshaped the face. You have given tight tissues. You have pulled the jaws up, or maybe you have slimmed the jaws, and now your face lifted him up.
Yes.
And you've done some maybe a rhinoplasty by pulling the nose a little bit, nasal alignment.
Yes.
And now he looks like a new film star.
Yeah.
Now, can he stop it there? Or does he require to maintain it?
Aging is something which will never stop.
Yeah.
Yeah. Nobody can stop aging. There is a part wherein you should also learn to age gracefully. And there's a part where, of course, there are things which you can do safely. You can take care of yourself. So self-care and self-love is one thing. And, aging gracefully is another thing. So you need to strike a balance between both the things. Age gracefully also. And also self-love and self-care.
So can I say rightly that a cosmetic surgeon is more an art on part?
It is.
Yeah?
It is. A lot.
So completely.
A lot.
But I'm sure you must be having some technology that will support you in terms of showing them the preface before the surgery starts.
There are a lot of softwares. There is
that's where I was coming to.
There is 3D scanning available, which can tell you how your body will look after the procedure, or your face will look after the procedure.
And what's the accuracy?
It's fairly decent. But
yet it requires an experienced hands.
I usually don't like to do this because the patient's expectation always, increases when they see these images. Now, if I see my perfect nose in an image, I would expect this to come immediately after the procedure. But no procedure is immediate. There is a whole way of healing and swelling to go away and care to be taken. So expectations too high is always a difficult thing. So I don't like these softwares, even though it gives a lot of information, but it'll give you an information what your nose will look like after a year and not immediate.
Okay. So it means the effects are going to be after a year.
Yeah. So for any good surgery will have subtle effect, will have natural effect, and will be slow to show.
But everyone wants with the click of a button.
Yes. Everybody wants that. As soon as they come out of the theater, they should be a different person. So that's where, consultation, counseling, and explanation should play a part.
Is social media putting a huge pressure on it? Because a decade back, only film stars or people who are more prone to camera.
Yes.
Or maybe whose work involved on showing themselves on camera used to follow this.
Yes.
But today, everyone has a camera by itself. You know, and if you see, the iPhone cameras are enhancing every time a new one is launched. I think we are transmitting the same processor, or maybe to a large extent only the camera is now upgrading every time. I think and added to that, the social media is pushing us to get the best version of ourselves.
Yes.
So is that putting a lot of pressure on you guys?
So I feel social media also gives you a platform where you can educate people, where you can tell them what is safe and what is good and what is not. But also from the point of view of a person who's just looking at things, they will always see the good part. So if I put frankly on my social media, I'll put my best results. And that's true for every surgeon or a physician who's going to put their pictures on their social media.
But the Instagram likes are the dopamine.
Yeah, but it's quite misleading. As a patient, you always see the best results. You don't see the risks involved. You don't see the healing involved. You just see before and after. That is quite misleading. But on the other hand, for me, I feel social media has been a boost to educate people, to tell them what is right and what is not.
What type of treatment is completely surgical as far as cosmetic is concerned? You said about the non-surgical part. Then what part is surgical?
Okay, so
or is rhinoplasty surgical?
Rhinoplasty is surgical. There are some people who do non-surgical rhinoplasty. They'll inject some filler, which is temporary. I'm not a big fan of this
aligning
procedure.
the nose bone, right?
So aligning, making the shape different, tip smaller, tip bigger, or the sides of the nose smaller.
And it's a growing trend.
It is a growing trend.
It's a global growing trend.
Yes.
I see that the trend is growing.
Yes. So surgically, if you talk about procedures, they start with the upper face for eyelids, for eyebrows, for droopy eyebrows. Then there is facelift, neck lift, ear reshaping. Sometimes people have prominent ear on the sides. Then fixing them to the skull, hair transplant. Then neck lift, chin augmentation can be so let's say
when there's so much of demand.
Yes,
it means the industry will be evolving every month or every 6 months.
It is.
How do you keep yourself updated?
Now,
because it's so much difficult for you.
Yes.
You're functionally involved in everyday's work.
Yes.
And now you need to upgrade yourself every day.
Correct.
To make sure that you read the latest news.
Correct.
And you're in line with the latest techniques that are available.
Yes. So one thing is you always keep attending conferences and read journals. What is the latest research with what is going on in your specialty, but also very important to look at trends which are on social media. People come up and say, "Doctor, can you do a Texas jawline?" And it's nowhere in our textbooks, nowhere in the research, nowhere in the books, but it's there on the social media. A Texas jawline is a strong masculine jawline, which has been seen in people of Texas.
Okay.
And ladies wanted to have a sharp jawline. It's called a Texas jawline. Similarly,
but don't you think it should be compatible with their genetics as well? Or is that it may not have a side effect?
Not necessarily.
Okay.
If not overdone, if not done in a way that that will harm a patient, then no. Sometimes people will say silk recontouring, which is nowhere in the books, but it's on social media.
That's permanent makeup, yeah?
Yeah. So there are different.
So you wake up fresh with makeup, yeah?
So you need to keep pace with all these trends also, and also legitimate research on journals, on in conferences.
So when you meet a lot of clients on the cosmetic forefront, what type of patients do you meet, or what type of clients you can meet? I will not even call them patients, in fact.
Yes.
Because they are not patients, actually. They come with more enhancing requirements.
Right.
And something that's in the trend.
Yeah.
So
we
are
like
they
to
models?
Call them clients.
Yeah, you call them clients. Okay,
yes.
That's what I'm saying.
Yes.
So they're morely, they're models, or they are film stars?
There are models, who come to me. I've done a lot of cabin crews. I've done a lot of models. But then
What's
I've
the
also-
gender percentage when it comes male, female?
I would say 60% are female, but
60%.
40%
40% are male.
are men.
Okay.
Yeah.
And what they come for?
So
Don't tell me that a male comes for jawline. I don't
so
think.
much.
Yeah?
You would be surprised.
Okay.
Yeah. One of the commonest procedures is liposuction.
Liposuction.
Yes.
Okay. Because of the obese.
Gynecomastia.
Okay.
Very common. Botox is very common.
Botox is common.
Extremely common.
Yeah? Okay.
And, part of demographic is just housewives who had 4 kids, 5 kids. Now they want to take care of their bodies, lose skin, excess fat. So it's not just those models who like to do
What's
these.
liposuction? Let's get into the basics of liposuction. I mean, is it a surgical procedure?
As simple
or
as
is it just
it's a surgical procedure. Yeah.
Or is it just you pull up the you vacuum the entire fat out of the body?
Literally, we do that, but it's surgically under anesthesia, either local or full
So
anesthesia.
you put an anesthesia.
Yes.
Okay. And what's the time?
Now again, depends on how much is the liposuction which we need to do. It can be sometimes just a double chin, or it can be a
Big
huge
belly,
obese big belly. So liposuction is not for weight loss, but it's just to remove the fat which is stubborn, which is not going otherwise by exercise and diet control.
Okay.
Yeah.
So if you remove this fat,
Yes.
will it come again?
It
One more
can-
thing. And does the tissues in the process get damaged?
Okay.
Because there's a lot of fear.
Very valid
Because of the
question.
unknown.
Yeah. Very
That's where
valid
we want to
question.
clear that doubt.
Yeah.
Because most of the people think, okay, liposuction is there. I want to do liposuction because I tried my best to reduce my weight, but I couldn't reduce it.
Right.
My fat is getting stubborn.
Yes.
I mean, of course, this fat did not come in a day. It came maybe out of 2 years, 3 years, 4 years.
Absolutely.
But it's not going down. When it's not going down,
Yes.
so you went for a treatment, you want someone to suck it out.
Yeah.
But is it going to come again? And during that sucking out procedure, is it going to damage the tissue and how safe it is?
So the number of cells which contain fat is fixed.
Okay.
When we remove these cells, when we remove this fat, the number of cells is reduced. But then every cell has a capacity to grow up to 40 times its size. So fat can come back if you don't fix your lifestyle. It has to be complemented by a strict diet control and exercise so that your results are long term, not just immediate.
So somewhere they need to change the lifestyle.
It has to
because
be there.
everything was accumulated because of the lifestyle.
Yes.
So it means once this is sucked,
Yes.
you went back to shape now. Now you need to start maintaining it.
The ideal candidate would be a person who's already doing good food and exercise and still has some areas which are not just, they're not going. That is the ideal candidate for liposuction because he's already motivated, already going to the gym, already eating healthy, and now has come with problems which are not going away easily.
But is it safe? Yeah.
It's safe. Again, it's a surgical procedure.
Does it have side effects in the long term?
Again,
Because that's where the fear comes in.
If we take good precautions, it's extremely safe. It's one of the safest procedures that I know of.
Okay.
Yeah. It's a blunt cannula. It doesn't go inside, it doesn't harm
And
any
the
vital
external
structure.
skin doesn't keep sagging.
So
And you can tighten that skin as well.
we
Yeah?
can, but that's also important, in the assessment when the patient comes to you, whether there are stretch marks, is the skin too loose, can we do something about it, or do we have to remove that excess skin? So there are candidates who are for some surgical treatment clubbed with liposuction. Like there is a recent or let's say relatively recent technology called J plasma. So we do liposuction and then we use this helium technology to tighten the skin.
Is genetics got to do with anything?
It has.
Because
Hormones,
maybe someone
genetics.
is working hard. He's going back to the gyms. He's
Yes.
eating clean.
Yes.
He's now vacuumed his entire fat out.
Yes.
He's still getting fat. What's the reply for that?
So
Because
genetics.
I seen that in this Anant Ambani.
Yeah.
I mean, they can afford everything in this world. 4 years back, or maybe 5-6 years back, he was very slim. They had done this liposuction and they had made him slim trim.
Yes.
And now when the videos came for his marriage, he was back to that big slab of body, which he has. And I'm sure that there'll be something with regards to his genetics.
Yeah.
That he's keeping on growing. And on the other side, I look at Adnan Sami.
Yeah. Yes.
He was also a big guy, fat guy.
Yes.
From Pakistan, who's taken the Indian national.
Yes.
And after doing the liposuction, today he's in great shape.
Yes. He did something which is known as bariatric surgery.
Okay.
Bariatric surgery is another field of weight loss surgery.
Okay.
So I told you liposuction is not for weight loss.
Okay.
Weight loss surgery as such is called bariatric surgery. Okay. Now in bariatric surgery, and this is done by gastrosurgeons.
Okay.
Plastic surgeons don't do bariatric surgery. What they do is they reduce the size of the stomach, the actual stomach in which food goes.
Okay.
So reducing the size of the stomach, whenever you eat, you feel full very quickly. It sends a signal to your brain that enough, you've eaten enough. So you stop eating and gradually you start losing weight. And there are multiple procedures.
But this is an organ.
It's an organ.
You have now squeezed the organ.
Yes.
This can have other repercussions of the body.
Also, I'm not a big fan, but then there are people who are morbidly obese.
Okay.
For a person who's unable to maintain a normal lifestyle, unable to do day-to-day work, get out of bed, maintain hygiene, of course for them this is a blessing. Even if you are doing something with their internal organs, it's a blessing.
So what is fat freezing then?
Fat freezing is
also another
it's a non-surgical.
You see the new words coming up, in the aesthetic space, and now fat's freezing. I said, okay.
Yeah.
So I want to understand what is fat freezing?
Fat freezing is also known as cryotherapy. Fat freezing is basically an outpatient procedure. It's a non-surgical procedure in which a part of your fatty area is sucked into a machine and it's frozen to 6 to 8 degrees, centigrade. So
but it's a part of your body only still.
It's still part of your body.
So it's just compressed.
It is compressed and made
frozen,
made cold.
Okay.
Yeah, not actually frozen.
But it's a part of your weight.
Yes, and then body starts eating.
I think this is more complex. Yeah. I mean holding that fat and now you freezed it.
Yes,
and now you're not allowing it to melt also.
Yeah, and then the body takes care of it. It just washes away because it's just dead tissue.
Okay.
It's quite unpredictable. I've seen people who have been treated with cryo, one side smaller, one side bigger. I've seen thermal marks, pigmentation marks on the skin. So I'm not again a big fan of cryotherapy. But then you would say that you are a surgeon. You will of course love surgery.
Yeah. And what will be the cost of it?
Cost of liposuction?
Yeah, liposuction. Mostly belly fat. I'm saying.
Belly fat. Average, I would say 12,000. It'll start at 12,000 to 25,000, and there are people who do it at way higher.
Okay. And the success rate is like almost 100%.
Like it's very predictable.
It's predictable.
I can tell you how much fat I'm going to remove. I can show you in a jar how much fat I have removed.
Wow.
So it's an absolute thing. It's not something which I can explain to you and you won't understand. It's something which I can show you in the jar, that this much fat has been taken out from your stomach. This is your fat.
God. Oh my God. Yeah. And it's painless as well. So can be made painless.
Yes, we take good care so that it's as pain-free as possible.
One more thing, once you conduct these surgeries, can they be refixed or basically, suppose if a person comes and says, okay, I want to fix or maybe I need a fillers in my lips.
Yes.
And you conduct a surgery.
Yes.
And I'm not happy with it. Can be refixed?
Yes.
Is there a reversal module to it? Or is it that another operation needs to be done or another surgery needs to be done only as a correction?
Let me put it this way. So surgery itself is a science, and it's not a perfect science. It's not something which is like an input-output module wherein you input some information and you get some results. Surgery also depends on your lifestyle. It also depends on your body, and every individual is different. Every surgeon is different. Their training, their viewpoint, so much goes into planning and executing a surgery. And then the post-operative care. then you should not smoke. What should be your lifestyle and whatever.
I mean, the lifestyle is going to complement the surgery.
Absolutely.
In terms of making sure that it's maintainable.
Yes. So the result is not just that half an hour or 1 hour of surgery. It's also the next few months and also preparation before the surgery. So things can go wrong. Of course, things can go wrong. But as a surgeon, it's my responsibility to take all precautions before the procedure that it's safe for the patient. And as a patient, it's so much more important to follow all instructions which have been given to the patient and give all information before the procedure. So that goes into the result. And now when things sometimes go not according to the plan, there are procedures which can be done to salvage, done to help. But sometimes these surgeries are done at illegitimate places, at places where licensing, where regulations are not that strict.
Yeah, but Dubai is a very regulated market.
Absolutely.
Even though
Yes.
my question was that what type of patients really do you get for reconstructive body parts? What are the type of patients that you receive?
Yeah, for reconstructive procedures, the bulk of
Only for reconstructive as of now.
the bulk of patients comes from industrial injuries.
Okay.
Yes, workplace injuries. Even the workplace injuries are much lesser as compared to places where it's not regulated.
So are these injuries very severe?
Not really.
Okay.
Usually these are trivial injuries as far as we see them. But imagine for a worker losing an index finger or losing a thumb, how devastating it can be. Even though looking at the full body, it's just a finger, but the dexterity or the
So if he gets a finger cut,
yes,
you can refix it?
so there are ways to do it. If it's cut sharp, if it's brought in time to us,
Suppose it's dismantled completely.
Yes.
You can refix it?
It can be done. Yes.
Okay.
One of my first cases which I did in India was a severed hand which was brought in a bag, and it was a girl of 9 years, and operated overnight and fixed it. So these things are possible. These things are done. But then crushed
Medically,
injury-
it was possible
yes,
to connect
it
the
is.
veins back.
It is absolutely arteries, veins, nerves,
Oh my
tendons,
God.
bones. So it's a whole process.
So
It is possible.
tell me one unique story in Dubai. What really happened to you? I mean, in some story,
Okay, so
that there was the rarest of your cases.
okay, so this is one case which I'm really proud of myself that I did it. of
And you're
course.
very emotional about it. Yeah? I can see that emotions. here.
Yes. So this was a 9-year-old boy who came from Nigeria.
Okay.
And these were three brothers who went to their grandfather to celebrate Christmas. And there they found a firearm in their cupboard, grandfather's firearm. Unfortunately, it was
This happened in Dubai, yeah?
It happened in Nigeria.
happened in Nigeria.
Firearm injuries don't happen
Okay.
here. So
Okay.
thankfully, it's so regulated here. So
Correct.
So this was in Nigeria, and kids, they are just fiddling with things. They found this gun. They started pointing at each other, and it misfired. And this 9-year-old had an injury in his foot.
Okay.
So his mid part of the foot was almost missing, and they got
The bone was crushed.
the bone was gone. There was I would say a hole of almost 10 centimeters in the foot. So the front of the foot, the back of the foot was still attached, but with a small, tissue. Now they went to Abuja University Hospital, big hospitals wherever they could, and everybody said that it has to be amputated. There is no other way. There was no blood supply. There was very little survival in that foot. So they started sending inquiries to other countries, to India, to UAE, to US, and fortunately they were able to do it. So pictures came to us, and I said we can give it a try. But from a distance, it's very difficult to trust a doctor, trust a
100%.
So they came, and they wanted consultation with a lot of doctors here. So they went to different hospitals, and they finally landed up with me. So I saw that for this child was very in extreme pain. So I just made him comfortable, and mom said that something happened here, that the child is comfortable, and I trust this doctor more than anybody else. Something happened. So we did a 14-hour surgery, We transferred tissue from his back to the foot. The foot survived,
Okay.
but it was still soft because there was no
But
bone.
do these tissues match?
Yeah, so-
Because it's a
because
part of
it's-
a different part of a body.
Yes, but it's
And you
your
can
own body.
It's your own body.
So it doesn't get rejected or anything.
Okay. So the DNA, everything matches.
Absolutely.
Okay.
So it's called a free tissue transfer. We did a transfer from from his back to his foot, and it survived. But the main part which we did was 3D printing his missing bone by using 3D printing technology, and we printed a titanium bone.
And that's where Dubai stands out.
Absolutely. So
Okay.
that's one reconstruction which we have done. He's now almost 15 years. And he plays football, he does sports.
What are you saying?
Yes, he runs, and you cannot tell that his foot has been operated. So that makes
my
me really,
God. This is a
proud.
very unique story. And in fact, I'm sure the rest of his life, he must be literally thanking you for what he is today. I think this is amazing information, I think, and just understanding how reconstructive surgeries and the cosmetic world is evolved. I mean,
Yes.
I also read about that. There's a book that you've written on the evolution of, I think, the surgical instruments.
Yeah.
What's this book all about?
So they started as a research subject in my training time. And I was very surprised when my professor told me that you should research on instrumentation. I was like,
Okay.
is he just trying to keep me away from patients? Because this was not a clinical thing. But then this opened a whole realm of knowledge, because there was instrumentation from Sushruta's time, which I saw. I saw instrumentation from the East India Company time when the Britishers came to India. I contacted with museums in UK, museums in US. So much of information came, which I had to assimilate. And
These complex instruments existed at that time?
not so complicated as what is present now. Like
Yeah, I mean, today it's a mix of digital
Yeah,
as well.
it's-
But at least the analog machines.
there were instruments which were so let's say smart and so innovative for that time, and they have been preserved in so many museums. And so I put them together and I studied how they changed, how the metals changed, how the processing of these instruments changed, and how it affected the results of surgery. So that came up like a research paper initially, and then because there was so much information, I packed it into a book.
And you published the book, yeah?
Yes, it got published, and it got translated in more than 6 languages.
Oh,
Yeah.
this is great achievement.
Thank you. Thank you.
So, Dr. Faisal, thank you so much for coming on the show. I mean, this is so much of insight, that you have given to all the audience who's actually going to listen to this conversation. Because most of them think that, we know about it. But there's really, there's so much to be learning from it. And especially from when you learn it from the expert. I mean, there's so much credit on the conversations. And I have to say thank you very much.
Thank
And
you
thank
so
you
much.
for accepting our invite.
Thank you for having me. Thank you.
Thank you, guys.
Thank you.